always get asked the question, what's the best strategy? Do you think decats are better than phosphorus? I think for one farm, if I have a problem with high potassium, I'm not going to fix it with the phosphate binders. If I have a problem with high phosphatides, I'm not going to fix it with the decats. I mean, the hand brake is essentially the high phosphorus. Don't try to compensate that by hitting the gas, by putting more anionic salts in there. Just loosen the brake, lower the phosphorus, loosen the potassium, lower the potassium, and try to fix the biggest issue, and then use the rest as a complementary tool.
Good afternoon, and welcome to the Dairy Blackbelt Podcast. This is Mark Thomas checking in, and it's a pleasure today to have with us Dr. Walter Gruenberg from Giessen University in Germany. So, good afternoon, Walter.
Yeah, thank you for having me this afternoon.
So, for those of you who have video on, you can see I'm in my truck, and apologies for that, but real life on-site troubleshooting some calf issues at one of our clients here in Mexico. And Walter was kind enough to delay our contact by a few minutes so we could connect today on a Friday afternoon and talk about phosphorus metabolism, and especially phosphorus and dry and close-up cows. So Walter, as we get into the topic, tell us how you became interested in phosphorus metabolism specifically, and then some of the work you're doing and understanding of this important mineral in dairy nutrition.
Well, to begin with, I mean, this was about when I was a junior assistant at the university in Berlin at the cattle clinic. I was basically chasing the hypophosphatemic down cow, right? And I was pretty convinced that this is an issue, and I wanted to figure out what the mechanism behind this and how to treat it. And in the process, I found all sorts of inducing hypophosphatemia in these cows, so basically dropping the blood phosphorus to below detection limit. And unfortunately, I was unable until today to induce hypophosphatemic recumbency. But in the meantime, we found all sorts of other interesting things where phosphorus plays a role, so that I said that, well, I'm not sure if phosphorus really causes recumbency, but I seriously believe if it does, this is a minor issue, because the role of phosphorus in metabolism is way more important. And one of the things we figured out was that there is very effective counter-regulation to phosphorus deprivation. In the past, we always thought that phosphorus is not regulated directly. This happens through calcium. And when we triggered our phosphorus deprivation issues, we were able to disconnect calcium from phosphorus. So we were able to induce hypophosphatemia without affecting the calcium. And we saw that the cows were super effective in counter-regulating. And one of the main mechanisms was bone mobilization. And we figured out that bone mobilization in a phosphorus-deprived cow is way stronger than what you actually see in a calcium-deprived cow. And this was a bit contradictory to what we understood in the past, because we always thought, well, if you have a phosphorus problem, you probably exacerbate hypocalcemia. And from what we saw, at least in non-periparturient cows, it was just the opposite. You started mobilizing bone, you released a lot of calcium from bone. And in the end, we basically followed up. So now we're going to go for the transition cow. And we did the same thing. We the phosphorus-deprived transition cows, and we saw there's a whopping amount of bone mobilized, calcium released from bone. And in the end, it turned out that phosphorus-depriving a dry cow had a beneficial effect on the calcium balance around calving. But the problem was that if you followed up, then you kept phosphorus-depriving the cows in the first days of lactation, then you saw that basically hell broke loose. Cows stopped eating, milk dropped, they got DAs, they got ketosis, they got hemoglobinuria, all sorts of fancy things that you do not want to have, right? And this is basically where we dug in and we said, okay, so how does this work? What's the mechanism? Is it really beneficial? Is it innocuous to lower the phosphorus balance in a dry cow? And if it is, to what point is it innocuous? Can you do it? Or do you risk to cause side effects? And this is another issue we have. We don't really understand the side effects of phosphorus depression. We know that there is hemoglobinuria. I mentioned that we assume that there is a link to recumbency, although we do not know until today. But I'm not saying it's not the case. I'm just saying we were unable to induce it. But I think the biggest concern I would have is feed intake depression. This is the most consistent sign we see with phosphorus deficiency, not just in cow. We see that in all species. We see that in humans, in dogs, in cats, in horses. When you phosphorus deprive an individual, it becomes anorectic. And this is probably something, if you have severe phosphorus deprivation, that will become clinically apparent. But how does that translate to a transition cow? She's moderately phosphorus deficient, and let's say she's eating a pound, 2 pounds less in early lactation. You assume that there was a benefit of improving calcium balance, but the strings attached may have been phosphorus deprivation, but we can't quantify, right? Which means now we get all excited about phosphorus depriving because this is a benefit for the calcium balance, but we still need to get the whole picture. And this is essentially what drives me at the moment to better understand how the whole system works.
Why Genetics turns podcast airtime into brand authority. We don't sell ads, we elevate voices. Curious how far your voice can go to become a reference in the industry and attract more leads? Scan the QR code and discover how we can turn your expertise into unmatched brand authority. Let's transform expertise into influence, starting now.
Some of the strategies that have been implemented in the past 4+ years with phosphorus binders in pre-calving, replacing anionic salts, therefore, as we know, work, but make sense based on what your research has shown. But are you still doubting, if you will? I mean, in most of these rations, obviously, we're not using the binders post-calving, so we're sequestering that phosphorus in close up, and then, after calving, they're eating a fresh diet with phosphorus availability. Is that a good strategy to implement from your research, or is there some question there?
No, it is certainly a strategy that is ideal, essentially, with the objective to mitigate hypocalcemia around calving. But the concern I would have is that what we're lacking is, like, let's say for the DCADs, when we're using DCADs, we have the parameter urine pH is essentially the dose to look for the appropriate dosage of the anionic salts, right? For the phosphate binders, we do not really get a good grip about how much phosphorus deprivation is beneficial, and where do we reach the point where we exacerbating this phosphorus deprivation that may not necessarily cause a problem at calving, but the cows in early lactation, they get into a negative phosphorus balance, like they get in a negative balance for whatever you want, for energy, for calcium, for whatever, and the cows cope well with that, provided they still have sufficient reserves. And that is our big unknown. We do not know how much reserves for phosphorus they do have, because it's basically intracellularly. And we do not know how much reserves they have to basically go well into lactation. So the big question here is, how much is too much, and how much is enough, essentially, to deal with this. So I believe this is a very powerful tool. It's way more powerful than phosphorus depriving just by feeding a low phosphorus diet, simply because by feeding a low phosphorus diet, you're just making less phosphorus available from the diet. But with the binders, you're not just binding the phosphorus that is in the diet, you're also binding the salivary phosphorus. So you're basically actively removing endogenous phosphorus. So this is way more powerful to cause a negative phosphorus balance. But evidently, this always bears the risk that you may be pushing the whole system too far, right? And the most important thing is, do not feed it beyond the day of calving. And I would probably be worried if you have a one-phase dry period where you're feeding that for 6, maybe 8 weeks, because then you may just exacerbate the phosphate stores, the stores. I'm not talking about what's in the bone because the cow can mobilize that. I'm talking about the phosphorus that is in the cell that is needed for metabolism. And these are the things that we don't have a good grip on it on yet. And this is something we have to work. But this is a novel. It is a novel system, as a matter of fact, and we know it works well, but we're still lacking a bit the safety net around that to really say not to go beyond of what we have here. It's similar like a discussion for the DCATs where we say, how low do you want to push the urine pH? Is 6 enough, or do you want to go for 5? Do you have negative effects if you push it on 5? So the discussion is a bit similar. Difference is that with the phosphorus binders, this is a more novel area, right, where people are less opinionated about what's enough and what's not enough.
I think that's a great example, Walter. And I was just thinking that, and you brought it up exactly. You know, there's really two camps of acidification of cows. That lower pH, in the low 5 range, where you get very consistent pHs, but more of a risk to go too low and maybe reduce dry matter intake. And then, the camp which, our group is generally in, of more moderated pHs in that 5.8 to 6.2 or so range. A little less consistent, but really good performance, and then a bit lower risk of some dry matter depression, if you will. So I think that's a really excellent opportunity or example of a little more is not always better, correct?
Correct. But I think the important thing with the phosphorus issue is to understand is this system does not only work when you go below the requirements, because technically going below the requirements, that means to go well below 0.2%, which is basically it's not achievable with a standard ration without using phosphate binders. But on the other hand, we know that from epidemiological studies, we know that from field studies that feeding 0.3% is better than feeding 0.4, is better than feeding 0.5. So it's not just the phosphorus, the bone mobilization. It's also, there are some other factors that play a role there. So if you're feeding, let's say, a ration with 0.4, here in Germany, we're feeding dry cows with canola. So we're basically pumping them with phosphorus. We have rations that have 0.5%. And this is a voucher for milk fever. Right, and if you reach the level, if you're able to go from 0.4 to 0.3, this will already be a benefit, even if it's not working through bone mobilization. Right, so in this case, I mean, the lower, the better. In the past, we said, well, if you have worries about fertility, whatever, just try a bit more phosphorus. Doesn't work? Give it a bit more, right? Today, we say it's not only there is no benefit of feeding phosphorus in excess of requirements, it's actually harmful for health and productivity, right? So if you can't reach below 0.2, if you go from 0.4 to 0.3, it will already be a benefit. It's similar to the DCATs. All right, the DCATs, I mean, evidently the target can be minus 150, minus 200. But if you are on 300 plus milliequivalent per kilo, and you go 100, that will already lower the risk for hypocalcemia. And for phosphorus, it might just be the same. And then if you see the thing as a whole complex thing, you do not look at, I'm going to fix my hypocalcemia problem with the binders, but I'm using a combination, which means I'm lowering the potassium, I'm increasing the magnesium, I'm lowering the phosphorus. The combination of all you may just use it as a complementary tool, right? It's not that you have to sit, I bet on DCATs, or I bet on binders, or I bet on I don't know, oral calcium. Just see what you have available on the farm, what the opportunities are, and try to find the best blending for that specific situation.
Walter, I think that's probably the take-home point that I am hearing, is that there are multiple strategies that can work. Obviously, and as you just said, find the strategy, the tool that works best in that situation, and then make sure you formulate, make sure you monitor where you're at on that phosphorus level, because too much is not good, too little, and then especially post calving, get those cows right onto that fresh ration with, if you will, the requirements of phosphorus that they need.
Yeah, I mean, that's the point. I mean, I always get asked the question, what's the best strategy? Do you think decats are better than phosphorus? I think for one farm, if I have a problem with high potassium, I'm not going to fix it with the phosphate binders. If I have a problem with high phosphate diets, I'm not going to fix it with the decats. I mean, the hand brake is essentially the high phosphorus. Don't try to compensate that by hitting the gas, by putting more anionic salts in there. Just loosen the brake, lower the phosphorus, loosen the potassium, lower the potassium, and try to fix the biggest issue, and then use the rest as a complementary tool. That is my approach, my thinking. That's
perfect. I really like that approach of working with each individual farm, each individual dairy, and meeting what the needs are based on performance and on opportunities.
Identify the risk factors. That's the main issue, right? Identify the risk factor. Just try to get them off, or at least weaken them, soften them, and then just put the loose on. Try to merge the loose ends.
So, Walter, this certainly is a topic I have to bring up to our sponsors, that we could certainly turn this into a dairy podcast show with more discussion on phosphorus. Thank you so much for your time. It's a Friday afternoon. You have a wonderful weekend in Germany. To all of our listeners, thanks for joining. And again, always keep our sponsors in mind that make this Wysenetics podcast possible.
And thanks for having me, and have safe travels.
Thank you. With that, Mark Thomas with the Dairy Blackbelt Podcast, signing off. Have a great day.